CBT Sample Questions. Question number 1. The nurse has been promoted to unit manager. Which advice offered by a senior unit manager will help this nurse become inspirational and motivational in this new role? Option A. Don't be too soft on the staff. If they make a mistake, be certain to reprimand them immediately. Option number B. Give your best nurses extra attention and rewards for their help. Option C. Never gets into a disagreement with a staff member. Option D, which is the correct answer. If you make a mistake with your staff, admit it, apologize, and correct the error if possible. Next question. What is the most important issue confronting nurse managers using situational leadership? Option A. Leaders can choose one of the 4 leadership styles when faced with a new situation. Option B. Personality traits and leaders' power base influence the leader's choice of style. Option C. Values placed on the accomplished of tasks and on interpersonal relationships between leader and group members and among group members. Option D. Leadership style differs for a group whose members are at different levels of maturity. Option C is the right answer. Next question. The famous 14 principles of management was first defined by Option A. James Watt, Option B. Adam Smith, Option C. Henry Fayol, and Option D. Elton Mayo. Option C is the right answer. Next question. You are a new and inexperienced staff. Which of the following actions will you do during your first day on the clinical area? Option A. Acknowledge your limitations. Seek supervision from your team leader. Option B. Volunteer to do the drug rounds. Option C. Help in admitting the patients. Option D. Answer all inquiries from the patients. Option C is the right answer. Next question. A patient has sexual interest in you. What would you do? Option A. Just avoid it because the problem can be the manifestation of the underlying disorder and it would be resolved by its own as he recovers. Option B. Never attend that patient. Option C, the right answer. Try to re-establish the therapeutic communication and relationship with the patient and inform the manager for support. Option D, inform police. Next question. One of your young patients displayed an overt sexual behavior directly to you. How will you best respond to this? Option A. Talk to the patient about the situation to re-establish and maintain professional boundaries and relationship. Option B. Ignore the behavior as this is a part of the development process. Option C. Report the patient to their relatives. Option D. Inform line manager of the incident. Both option A and D can be the right answers. Next question. A nurse from medical surgical unit asked to work on the orthopedic unit. The medical surgical nurse has no orthopedic nursing experience. Which client should be assigned to the medical surgical nurse? Option A client with a cast for a fractured femur and who has a numbness and discoloration of the toes. Option B a client with balanced skeletal traction and who needs assistance with morning care. Option C, a client who has an above-the-knee amputation yesterday and has a temperature of 101.4 degree Fahrenheit. Option D, a client who had a total hip replacement 2 days ago and needs blood glucose monitoring. Option A is the correct answer. Next question. When group members are unable and unwilling to practice in making a decision, which leadership style should the nurse manager use? A. Participate. B. Authoritarian. C. Laissez-faire. D. Democratic. B is the right answer. Next question. The nursing staff communicates that the new manager has a focus on the bottom line and little concern for the quality of care. What is likely true of this nurse manager? Option A. The manager is unwilling to listen to the staff concerns unless they have an impact on costs. Option B. The manager understands the organization's values and how they mesh with the manager's values. Option C. The manager is communicating the importance of a caring environment. Option D. The manager is looking at the total care picture. Option A is the right answer. The manager is unwilling to listen to staff concerns unless they have an impact on course. Next question. An example of a positive outcome of a nurse-health team relationship would be Option A. Receiving encouragement and support from co-workers. to cope with the many stressors of the nursing role. Option B, becoming an effective change agent in the community. Option C, an increased understanding of the family dynamics that affects the client. Option D, an increased understanding of what the client perceives as meaningful from his or her perspective. Option A is the right answer. Next question. The characteristic of an effective leader include option A, attention to detail, option B, sound problem solving skills and strong people skills, option C, emphasis on consistent job performance, option D, all of the above. The right answer is option B. I must consider all of the above also a right answer. Next question. The following are qualities of a good leader except option A, shows empathy to members, option B, his behavior contributes to the team, option C, acknowledges and accepts members' mistakes without any corrections, option D, does not accept criticism from members. It's quite evident that option C is the right answer, acknowledges and accepts members' mistakes without any corrections. Next question. All of the staff nurses on duty notice that a newly hired staff nurse has been selective of her tasks. All of them thought that she has a limited knowledge of the procedures. What should the manager do in this situation? Option A, reprimand the new staff nurse in front of everyone that what she is doing is unacceptable. Option B, call the new nurse and talk to her privately. Ask how the manager can be of help to improve her situation, which is the right answer. Another options are option C, ignore the incident and just continue with what she was doing. Option D, assign someone to guide the new staff nurse until she is competent in doing her tasks. Option B is the right answer. Next question. Which option best illustrates a positive outcome for managed care? Option A, refacing current policy. Option B, involvement in the political process. Option C, increase in preventive services. Option D, cost benefit analysis. Option C is the right answer. Next question. Describe the primary focus of a manager in a knowledge work environment. Option A, developing the most effective teams. Option B, taking risks. Option C, routine work. Option D, understanding the history of the organization. Option A is the right answer. Next question. There have been several patients complaining that the staff members of the unit are disorganized and that no one seems to know what to do or when to do it. The staff members concur that they don't have a real sense of direction or guidance from the leader. Which type of leadership is this unit experiencing? Option A, autocratic. Option B, bureaucratic. Option C, laissez-faire. Option D, authoritarian. Option C, laissez-faire is the correct answer. Thanks for watching the video. All the very best for your exam and don't forget to practice several times before your exam. Bye bye.